Welcome back to West Texas View.
Okay, he has entered a new term into our discussion about our health, and that's that we must get enough sleep. And that's for all of these things we've been talking about, losing weight primarily. So tell us more about the sleep factor.
Yeah. If you don't sleep, puts you at risk for diabetes. People that stay up late, don't get sleep, shift work, you know, horrible, going from days swing to grave and back, especially if it regulates on 5, 7, and 10-day lengths of schedule changes. Red-eye plane flights. If you don't sleep, there's a lot of things that change. I made a list of them here for you.
Depression.
Lack of sleep is associated with depression. Lack of sleep really promotes high blood pressure. What's the point of taking a pill if you're not going to go to bed and help it anyway? Fibromyalgia, aches and pains that are diffuse everywhere. Weight gain, and it leads to diabetes. Isn't that amazing?
But see, I don't understand the correlation between sleep and obesity.
Yeah. When you sleep, there's a lot of things that happen. Body repairs itself, old wear and tear. Guess you reboot the hard drive up here. But you also reset. And you have to say, do my cortisol levels work right? If your cortisol levels are really high, you're going to gain weight. If you sleep right, your cortisol levels are correct and they're low in the morning. You release your growth hormones, which regulates whether or not you're going to make more sugar, make less sugar while you're asleep. If you don't sleep, these things are not released appropriately or at the right times or in the right amount. So there's a lot of hormonal control of your body that depends on, did you sleep your right amount of time? Something else kind of weird, you sleep in, it should be some multiple of 90 minutes. So just to simplify it, 7.5 hours minimum. Okay? Some multiple of 90 minutes.
And so what if you sleep too much?
There's a whole other segment there that's called extra napping in the daytime, which also promotes diabetes because when you nap in the daytime, you're not moving around. When you nap in the daytime, you don't sleep at night. So the cycles are wrong, and the time spans for which you're asleep are not regulated.
I see.
So naps, no. Get to bed on time.
And get a good night's sleep.
True.
And so, but you know, a lot of people have gotten into a habit of staying up late, having to get up early, and so then when they do have an opportunity to sleep late, they can't.
And and say, well, I'll sleep in on the weekends. That doesn't cut it. You can't catch up on a sleep deficit on the weekends. You know, we have a whole program for internal medicine residents. You know, when they're on call, how long are they supposed to be up for? We limited their hours by law. You know, they can't be on anymore. You know, this 24 and 72 hours. Right.
Can't drive.
Right. So we call it sleep hygiene. You know, correct sleep, length of time.
A clean sleep record.
There you go. Yeah.
Oh, so anyway, then there was a new research. Tell us about that at the Brigham and Women's Hospital.
Oh, the Brigham and Women's Hospital.
In which they cut the sleep to 5.5 hours.
Yeah. They gather a group of people and they get them all regulated, sleeping the right way, and then they say, well, okay, let's now switch on and off when the lighting occurs, when we let them go to bed, what kind of noise we have, what type of interferences exist. And what they found was people that were normal and healthy, when they changed all the biologic clocks and didn't allow them to sleep, cut it down to 5 hours, here's what they found. When they cut it down to 5 hours, they no longer actually regulated their body temperature the right way. Their blood sugars actually went up higher after eating because insulin was all screwed up for when it was released. And the metabolism slowed down, and they started gaining weight. Isn't that interesting?
Yes, that is interesting.
Just by changing your sleep patterns, they could duplicate the onset of diabetes.
So we're going back now to the basic common sense. Eat the right food in the right amount and get sleep, and you'll prevent diabetes.
Isn't that amazing? We spend millions and millions of dollars on research to prove what's so obvious.
And in this day where our medical system is being so strained from all of the extra baby boomers and all of the diabetes and all of this, it's just absolutely going to be necessary for us to prevent things.
Right. This brings us to a really, really important one. You know, we can talk about diabetes, we can talk about who gets it, but do you realize now that kids 10, 11, 12 are getting type 2, the disease that used to only occur when you were 60, 70, or 80? Kids with diabetes. So what kids get diabetes? Who do you think?
The ones that
The
sit
ones
and watch
that are overweight,
and
obesity.
watch TV and drink.
Yeah, I made a study. Yeah, we had done a study where we had looked at children now over 20 years. Started when they were 12 years old, and just watched. Well, what happens with them? And I'm not going to, outline, the whole protocol for the grant, but the upshot was this: when we watched all of these children over 20 years, if they were overweight as a child, 70% of them became severely overweight as adults, 250 pounds or more. Childhood obesity means adult obesity, diabetes, heart attack, and stroke. Isn't that amazing? If we look at the kids who were normal weight when they were, 10, 11, 12 years old, only 5% of them ever became obese.
That is amazing.
Childhood obesity should be really something that to be avoided. Or, a lot of people are beginning to ask, is childhood obesity a form of child abuse?
Yes. I was fixing to say it should be a crime. Because it's really dooming them to a life of feeling bad, being sick, being crippled, dying young.
Yeah.
And then the other thing that entered into this is that if you have obese parents, the likelihood of the children being obese.
Children give what children got is kind of the bottom line that we use in the youth ministry. How you treat them, how you raise them is how they're going to turn out.
Isn't that amazing?
Isn't it obvious?
The main job of parents is to teach and lead and train the children to come about. We're going to have to take a break right now. We'll be back in just a minute and continue this conversation.
Thanks for joining us for News West 9's West Texas View with Johnny Lou Avery. This has been a public affairs presentation of KWAB-TV and KWES-TV.